Good evening, everyone, and thank you so much for joining us tonight. Now, I wanted to try something different this evening. You know, most nights we try and cover as many as a half a dozen topics, given the firehouse of news here that we can get bombarded with. And while that hopefully gives you at home a broad offering over a course of an hour, often at the end of the show I wonder if we really dug below the surface, given how many topics we try and cram in. So for this hour, the folks at RFL and I figured that we'd focus on a single issue that we believe impacts a huge percentage of you, our audience. So tonight, and this has nothing to do with whether you're watching me on the East Coast, West Coast, or in between, we're going to dedicate the whole show to school reopenings, and we've got the head of one of the biggest teacher unions as our guest this evening to give her perspective here and trying to explain why so many of our kids still are not inside of a classroom. So what we're going to do is we're going to give you the facts, we'll hear the arguments for and against, and then we're going to turn the show over to you. So whether you're a parent or teacher or you just got a really passionate take on the topic, we open our phone lines and also our social media platform to you. So if I do this right, at the end of the hour, I believe all of us are going to know much more about an issue and how we feel about it with immense consequences than before this hour began. So to get us started with the latest on reopening our schools, let's bring in Andrew Whitman.
Well, Rich, the debate over schools, teachers, and COVID is a complicated one, as we'll endeavor to show over the next hour. And because it impacts so many people across so much of our nation, it is a debate that Americans have become passionate about. From the millions seeking a return to normalcy, demanding that schools reopen.
We can't take one more day of forcing them to sit in front of Zoom when they're not learning and they're hating school and they're depressed, they're dejected, their grades are falling, they're regressing. It's disgusting.
They need to figure it out. They're out of time. Science, facts, all states that these kids need to be in school.
To the equally passionate millions who worry for the safety of teachers and their families, who also want schools open, but only if it can be done in a way that keeps everyone safe.
I'm a mathematician. I can read statistical studies. Nobody has shared anything with me that convinces me that it's safe for me to go back to that school with a whole bunch of kids.
So many of our schools, not only across Washington state, but across the nation, are simply outdated. We have great concern about the air that we're breathing and how it's circulated on a good day, let alone during a global deadly pandemic.
The concern from the go slow and safe crowd on reopening schools is obvious. Unsafe reopenings could cost lives, lead to long-running ailments, and could potentially spread the virus just when it seems we might be close to turning a corner. But the science suggests that schools are or can be less of a worry for spreading COVID than other workplaces, and kids have lower rates of getting the virus and transmitting the virus than adults. Plus, people demanding schools reopen point to the damage being done by keeping them closed, like the impact on student grades, their college prospects, and their futures. In St. Paul, Minnesota, high school students are failing 2 of every 5 classes during COVID remote learning. Students across the Houston area also setting new records for failure, with some schools quadrupling the number of Fs they've given out. Keep in mind, some students have no way of participating in remote learning. More than 4 million households with kids have no internet access, and no widespread effort was made to get access to those families during the pandemic. Internet access, just one of the many disadvantages facing poorer students, disadvantages that were put on steroids during the pandemic. Pandemic learning also impacting the mental health of students. School closings, scarce jobs, and added family care responsibilities among the reasons mental health is declining among young people, with spikes in reports of depression, unwanted pregnancies, and suicide attempts. Mental health related visits to hospital emergency departments are up significantly for 5 to 11-year-olds. They're up even more for 12 to 17-year-olds between April and October when compared with the same period of 2019, that according to a CDC study. It's also impacting the physical health of millions of students. 30 million kids are eligible for free school lunches, but only 15% of them have been getting those meals during the pandemic. Even President Biden says he thinks about the added pain on students just trying to survive the pandemic.
I think about the price so many of my grandkids and your kids are going to pay for not having had the chance to finish whatever it was. That graduation where you didn't get to walk across the stage, I think they're going through a lot, these kids.
Of course, the impact of closed schools is not just limited to the students. It's also added to the burdens faced by parents and by women in particular, who end up facing, on average, the lion's share of added family and home care responsibilities during COVID. Far more women have left the workforce than men during it all as well. And of course, general consensus is that the economy cannot fully recover or return anywhere close to pre-COVID levels until schools reopen. And amid all that tension and confusion, the guidance from government has been underwhelming. Former President Trump focused on the economic and political impacts. He pushed for schools to reopen as early as possible, but he punted responsibility to states, so there were no uniform standards for reopening anywhere from state to state or even from district to district. President Biden has been more proactive, but even his comments have led to confusion. This clip from a town hall had many convinced that Biden wanted all teachers vaccinated before schools could reopen, which was not the message of his administration.
I think that we should be vaccinating teachers. We should move them up in the hierarchy as well.
A few days later, the CDC formally updated its guidance for reopening schools. Essential requirements include reducing the spread of COVID through mitigation techniques like masks, social distancing, hand washing, and contact tracing. Also key, the risk level of community spread where the school is located. If it's spreading fast, it's more likely to spread in schools. And schools need to have options for remote learning ready to go. Then there are additional levels of prevention listed in the report but not required, including enhanced testing and vaccinations for teachers and other staff. The head of the Biden CDC summarized the school guidance like this.
What we would advocate for is to have more kids in school as our community spread comes down. What we have said in our guidance is that the amount of classroom activity really depends on the amount of spread in the community. We know that the amount of disease in the community is completely reflected as to what's happening in school. If there's more disease in the community, there will be more in school, and that most disease in school does not come from in-school transmission, but comes from outside into the community.
But that guidance has not translated in a number of high-profile school districts. In San Francisco, the mayor says she's looked at the science and it's time to reopen.
Our public health experts have been amongst the most conservative in the country when it comes to making decisions around public health. And the fact that they are saying to us that schools can reopen is the only reason why I would even push to try and move forward in this process as quickly as possible.
But she and the city had to actually sue the city's school board to try and reopen schools. The board now agrees. They're just waiting on the teachers to okay the plan, and teachers want to be vaccinated before reopening. And despite that, the mayor says she understands the concerns of teachers.
There are some, educators who have some genuine fears, of course. They may have underlying health conditions themselves. They may have parents or family members they're caring for with underlying health conditions, and they may be concerned about, their own personal health. And I think that the concerns are legitimate. But there also are other educators who are ready to go back in the classroom. But ultimately, it's up to the school district and the union to come up with an agreement for returning to in-person education.
Similar story in Chicago made headlines for months. Teachers there just voted to go back to class. And yet, despite all the competing interests and concerns, not to mention the obvious downsides and frustrations that come with so many schools operating so far from normal for so long, the public doesn't appear to be in the same lather over school reopenings as some headlines might suggest. A new nationwide Quinnipiac poll shows a plurality. 47% of Americans say they're okay with the current pace of reopening schools. About a quarter of Americans think they're opening too slowly, but 1 in 5 think they're reopening too quickly. There is much more agreement that teachers should get priority access to the vaccines. 3/4 of Americans support that idea. Rich?
All right, Andrew, thank you. So a lot to unpack here. I can't think of a better guest to help us with that. Randi Weingarten, president of the American Federation of Teachers, which is 1.7 million members across this country. Randi, always good talking to you. Thank you.
You too, Richard.
Okay. First off, how should we look at teachers? And in the pandemic, we've learned to put different jobs in terms of different strata, in that we hear essential workers. Obviously, we think of people in hospitals, cops, firefighters. Should we put teachers in that same category?
Yes, of course. And, and when you have a president who's actually trying to help get teachers the protections and the safety that they need to do the job that they're being asked to do, you're in a different situation than with former President Trump. I think let's kind of think about it in terms of not the what happened beforehand, which was, the Trump administration, we begged for the guidance, we begged for the resources, and basically until December, we didn't get resources, and until President Biden came in, we didn't get any guidance. And President Biden has said we want to reopen schools, particularly K-8s, in the first 100 days of his administration. We want to do it safely, and we want to do it with the resources. And our union, 80% of my members are comfortable with that, and 85% of my members are comfortable with the basic trio of what we need to do to make this safe for school communities, including teachers and kids and whatnot. And that is, you have to have the layered mitigation strategies that CDC has talked about. You have to do testing, particularly in the high density areas. And the last is, let's get as many shots in the arms as we can, as quickly as we can, particularly for educators who are going back to in-person learning, whether it's bus drivers or other school personnel or educators.
Listen, I saw your appearance on Meet the Press. I don't think there's much daylight with you and I on this, because you said, listen, you trust the science, you heard what the CDC said, you believe that as long as they have mitigation, the air filtration systems, they separate the desks, and they got a plan to vaccinate the teachers, you believe that it's in everybody's self-interest, obviously the students, but also society, to get these kids back in the school. My question, though, is, isn't the devil in the details? What you and I might consider safe, some other teachers may say, time out. It's not starting. I want the whole faculty inoculated before I step foot into the school again. Or, yes, testing's fine, but I don't want it once a week. I want it twice a week, or whatever the case may be. Isn't this, if we try and satisfy everybody here before we can get going, doesn't it stop the process?
Well, but Richard, no one's trying to, look, what you're talking about is people's fears, and we need to respect those fears, and we need to meet those fears with facts. Teacher unions all across the country, we have about 3,500 locals. The NEA has many more. We're not monolithic. And so ultimately, we need to actually make sure that people trust that things are actually happening in schools. What you're hearing is years of distrust that something is going to be promised, but it doesn't happen. And that's what you're hearing when you hear that, out of the mouths of teachers who are scared. 71% said they are scared that they're going to bring COVID home to their families. And given that 500,000 people have died and millions have been infected, that concern is warranted. So the real issue is, in the places where we've had success, we've had school-based committees that have walked around and made sure that these things are happening. We've had situation rooms like we have in New York City, where if you don't have the PPE in a school, they call the situation room. It's run by the management and the union, and things get delivered within 24 hours. And what we've seen is that in places that have been reopened, like in elementary schools that have been reopened, people, and they have the mitigation factors in place, people trust it more. What you're seeing is a lot of distrust of whether or not something will happen, particularly in old buildings where we've been complaining about ventilation for years and nothing was changed.
I've spent a lot of time in the show taking the position, which I believe that teachers are both underappreciated and underpaid. But people said in this, unprecedented year that we've gone through, there have been sacrifices made from some that don't have the same luxuries of saying, yes, the facts may say one thing, but I feel differently. You may have seen this. Bloomberg's editorial board put out a piece on this, and they said in part, quote, the pandemic has demanded sacrifices from everyone. Hospital employees and first responders who work in environments far more dangerous than classrooms and who are also often represented by unions, as well as transportation workers and other public employees. They've steadfastly done their jobs throughout this crisis, honoring their responsibility to their communities and making the nation proud. Children in all of America need teachers to join them. Even, Randy, if that's a bit of a cheap shot, my point is something different. There's a feeling out there from a lot of people to say, wait a minute, if this conversation was happening back in April or May, I hear you, but we've spent close to, I don't know, nearly $70 billion. Bloomberg's pledged a number, $130 billion on top of that. Let's just go back to the classrooms already. The CDC says it's safe. That should be enough.
So let me interrupt you, because it was a cheap shot by Michael Bloomberg, and he knows better. And ultimately, teachers, including my union, and he credited us for doing this, have been trying to get schools reopened since last April. And it's only been 2 weeks ago that we actually got the CDC guidance, which some health people are still disputing because they think the mitigations are too much. But the bottom line is this: teachers all across America have been working harder than I've ever seen before. In teaching remotely, it is really hard to engage students. I see teachers all the time calling their students up, calling their parents up. We all want to be out of this. And at the end of the day, it is incumbent on all of us to make sure that things are both safe and that we have in-person learning. Teachers would have told you pre-pandemic that remote education is not a substitute. This is a matter of how do we make sure that everyone is both safe and in school. And frankly, and I like him very much, but Michael Bloomberg had a lot of nerve to actually tell teachers to tough it up when he works in a circumstance that has good ventilation and has all the protections that he needs.
Andrew mentioned in the wind-up, this 50-state approach was the stupidest thing since sliced bread. That said, if teachers are offered to be vaccinated and they refuse, you're seeing certain industries right now where, you know, you can't work certain jobs, travel, et cetera, if you're not willing to be vaccinated and represent the. Should that be a prerequisite for teachers here? If the vaccine is offered to them, if they don't take it, then the concerns of some of the other teachers, you know, that they want to have a vaccinated environment when they go back in front of the classroom.
So this is a moment where I don't think that you can mandate. Look, so I'm a big believer in vaccinations. I'm a big believer in 100% of people should be vaccinated. And we have to get through the fear, and we have to get through the conspiracy theories. So we have to get through vaccine hesitancy, and we have a job to do to create that kind of trust. So the bottom line right now is CDC has said it's not a prerequisite to go into school. It shouldn't be a prerequisite to keep somebody's job. We need to actually have and convince as many people to get vaccinated, and we need to get those shots in the arms. And ultimately, that's what we need to do. The mitigation strategies that stop the transmission of the virus are the mass physical distancing, the cleaning, washing your hands, and ventilation. And those are the things that have to happen.
All right, up next, more of my conversation with Randi Weingarten, and we'll take a look at all of the unintended consequences of closed schools, including the impact it's had on the mental health of kids, child abuse, and so much more. Our phone lines, they're open, remember, and we want you to be a big part of our program. The phone line's on the screen right now. Let us know whether or not you think schools ought to be forced to be reopened.